Hello, my name is Dr. Yaacov Lawrence from the Sheba Medical Center in Israel. The purpose of this webcast is to explain what is celiac plexus radiosurgery, and it's primarily aimed at potential patients and their families. It should be understood that celiac plexus radiosurgery is considered an experimental treatment that should only be delivered in the context of a formal clinical trial. More details about that trial are available on the web page that you can see here on the screen. We've received very generous funding from Gateway for Cancer Research. Gateway are committed to funding innovative cancer research that helps people with cancer feel better, live longer, and conquer cancer today. Further details are available at the web page, Twitter, and Facebook page described here on the screen. We also received some funding, especially for the initial pilot study from the Israeli Cancer Association for the pilot study that was performed at the Sheba Medical Center. So, let's talk about the pain which is experienced by patients with pancreatic cancer and other cancers in that area of the abdomen. So, typically 60% of such patients experience pain, and in approximately half of those patients they describe painkillers as providing insufficient benefit. Patients who experience severe pain feel unhappy and have decreased enjoyment of life. Where does that pain come from? So here we have to teach you a little anatomy. Here, as we look into abdomen, we can see the liver and the stomach. We go a bit deeper, we can see the pancreas, and if we go behind the pancreas, we can see the two kidneys and a number of large blood vessels. Here in blue you can see the vena cava, the largest vein in the body, and behind that the aorta, the largest artery. You can see here that in front of the aorta there's a mesh of yellow fibers. Those are actually nerve fibers, and they belong to a structure called the celiac plexus. The celiac plexus transfers pain sensation from the abdomen to the spine and further on to the brain. This black structure represents a cancerous tumor, and here you can see that it's pressing on those yellow fibers, pressing the nerves and also infiltrating them. As a result, patients feel pain. That pain is typically a combination of upper abdominal pain in the area which many people describe as the stomach, the lower back, and it's typically is described as a belt-like distribution. In this treatment, we give a single shot of high-dose radiation therapy directed specifically at the celiac plexus, those nerves, but also to some extent to the tumor. The aim of treatment is that following that radiation dose, the pain will subside. The tumor itself we expect to stay in the same position and of the same size. So what's the process? Well, following meeting a physician and signing consent form, the next step will be undergo what's called a simulation. Here we can see in a picture the patient lying down, and the simulation is essentially a form of a CT scan with one or two additions. Now, the number of techniques that can be used during the simulation. One is what's called abdominal compression. You can see this in the picture here. The patient is lying down, and there's a plastic plunger that presses down onto the stomach area, and that stops patients taking deep breaths during the treatment. They can still take shallow breaths, but they won't take deep breaths during treatment, which is important to us because during deep breathing all the contents of the abdomen can move, which would make radiation therapy a little more complicated. Also, typically a number of very small tattoos, dot-like marks are made on the skin, typically 3 or 4, These can be seen in the picture. Following the completion of the simulation, the patient will then go home, and it will be necessary for the physician and his team of physicists to plan the treatment. How long this takes will vary from hospital to hospital, typically about 10 to 14 days. Once the treatment's ready, the patient will receive a phone call to come in for treatment, and here we can see a patient lying down on a typical radiation machine, what's called a linear accelerator. An important part of the clinical trial is understanding the level of pain before and after treatment, and we'll be assessing that using a 10-point scale from 0 to 10. 0 is no pain, and 10 is the worst possible pain. And in this example, the patient has noted that they have pain of 5 out of 10. We also ask patients to fill out a pain diary, every day recording the typical, worst, and best pain, and also how many days, how many times a day they needed to take a pain breakthrough medication. We're also going to ask patients before and after treatment to fill out a number of questionnaires which assess quality of life. Typical questions would be: have you had trouble sleeping? How's your appetite been? And finally, also we'll perform a number of functional assessments to see if the patients are stronger or less strong after treatment. We'll ask them to see how far they can walk in 6 minutes, and also the strength of the muscles in the arm by doing what's called a hand grip test. So how good is the treatment? So based on our pilot study, we can say that the vast majority of patients, approximately 80%, had significant benefit regarding their pain levels. When I say significant benefit, that means that their pain level decreased on that 10-point scale by at least 2. However, in the majority of patients who responded, their pain went down by far more than that, and approximately a third of patients, the pain disappeared completely. Side effects. So there can be nausea or vomiting on the day of the treatment or the day after, and we've developed a regimen which your physician will tell you about, of taking some powerful anti-nausea medications on those 2 days to prevent vomiting and nausea as far as possible. Expect to feel a bit tired on the day of treatment and the day after. We've also noticed in a number of patients that they may have a temporary worsening of pain over the 5 to 10 days following treatment, and then subsequently the pain gets much less and may even disappear. So in summary, Celiac Plexus Radiosurgery is a new treatment for cancer pain, especially but not only that associated with pancreatic cancer. Currently the treatment is available only at the Sheba Medical Center, but over the coming year we hope to open the trial and have this treatment available at a number of sites across Europe and North America. I'd like once again to acknowledge the patients, the families, the different members of the healthcare and research team who have been helped make this treatment possible. In particular, I thank the financial support of Gateway for Cancer Research and also of the Israeli Cancer Association. Thank you very much.